All right, number 4. An older male client comes to the geriatric screening clinic complaining of pain in his left calf. The nurse notices a reddened area on the calf that is warm to touch, and the nurse suspects that the client may have thrombophlebitis. Which additional assessment is most important for the nurse to perform? A, measure calf circumference. B, auscultate the client's breath sounds. C, observe for ecchymosis and petechiae. And D, obtain the client's blood pressure. So 1, 2, and 3, of course, we need those reminders. Remember, this is something that we want to utilize every time we're answering these questions to help ensure we're not leaving anything on the table. We're identifying everything that's in there for us. So we know the ask, right? The question is simply asking us the most important assessment to do, right? And our problem here, the scenario, we have this older client. They come to the screening clinic. It says his left calf hurts. It's red. It's warm. And we think it's a thrombophlebitis. So all of this information, well, that's all the problem data, right? Here. What does that mean? Older client, they come in, hey, my calf hurts, and it's warm, and it's red, and we think it's a thrombophlebitis. What do we call that? What's another term for that? Yeah, DVT. Write that there. So you think this client has the DVT. That's the problem. So it's asking us the most important thing to do. Think they have a DVT. Now we got to find the solution, which is our answer. And remember, we are nurses. Yes, that means that we are applying our knowledge all the time, and we're constantly thinking intuitively, critically, forward, right? So that's our outcomes. So let's look at each of these, and let's practice that outcomes oriented type of thinking, right? So I'll start from D and work my way back up. I promise I'll stop doing that if it's confusing anybody. So D says, obtain the client's blood pressure. Okay. With our outcome-oriented thinking, how we can think about outcomes is like this. Obtain the client's blood pressure. All right. If I do that, if I choose this answer, what am I going to get? So if I do that, I'm going to get a value, right? I'm going to get a number. It'll be high, it'll be normal, or it'll be low. Whatever I get, does that do anything for the client and this DVT that I think they have? No. Good job. C says, observe for ecchymosis and petechiae. Okay? Outcome-oriented thinking tells me, nurse, that when you look at an answer, that you're going to choose it, you have to think about what the outcome's going to be, meaning what's the end result going to be of what you chose to do, what you chose in the question. So if I do this, if I observe for ecchymosis and petechiae, what am I going to get? Nothing, right? I'm going to look. I'm just looking at the client to see if there's any of this present. Any ecchymosis, any petechiae. Does that do anything for the client in this DVT that you think they have? No. And by the way, petechiae, we can see that in a fat embolus, but we wouldn't expect that in blood. So now we're left with A and B. We could measure the calf circumference, or we can listen to their breath sounds. So thinking about those outcomes, we want to make sure that we're understanding where that's going to bring us. What should we do? Now, wait a minute. Has anybody picked up on the type of question this is, right? This is one of our tools. Most important. This is a priority question. Now, priority questions, as you have heard or will hear in the lesson, anytime we have a priority question, we have to think about what is the thing that I must do, right? Options A, B, C, and D. What's the thing that I must do right now in order to avoid the worst potential outcome for my client? That is how we handle all priority questions. What do I have to do now, right now, to avoid the worst potential thing that could happen in this scenario? So, if we think the client has a DVT, what's the worst potential thing that could happen to this client? What are you thinking about right now, right? What's the worst potential thing? Thinking of DVT, I bet you're thinking, oh, well, that's a clot, right? And that blood clot could dislodge, could travel, could end up in the lungs as a pulmonary embolus, and that could be fatal for the client, right? So when we think about, all right, what's the priority? Priority is avoiding worst case. If that's the worst case, which one of these actions between A and B would help us to get ahead of that? Measuring the calf circumference, again, we're going to get a number. Whatever number you get, does that do anything for the client and the DVT you think they have? No. But B, auscultating the client's breath sounds. Absolutely. Because if we identify diminished breath sounds that are abnormal in someone that we think has a DVT, that could indicate a PE, right? And don't we want to be on top of that before we have a fatal issue? Yes, absolutely, yes. So B is the correct answer here. So big thing in looking at this question is recognizing that this is a priority question. And so we're going to be using our priority tool out of our toolkit. And that tool tells us, all right, what's happening? What's the worst case thing that could happen? Which one of these options would help me get ahead of that? Good job.